guess what? Well, today I'm going to be talking about different kinds of symptoms and injuries and some of my tricks to help you to prevent from them. And what would you get if you would get them? So let's go and see what are symptoms and injuries. Symptoms and injuries are kinds of different effects that affects your health. Kind of like if you have a cold or you sneeze. Let's look at some of them and see which way to prevent from them. First, we have is headache. Headache is a kind of symptoms. I want to say that symptoms and injuries aren't always the same. Symptoms are kinds of things, are kinds of feelings that you have inside of your body and that would maybe affect outside of you. It just happens where always in your bodies. But injuries are kind of cut or kind of something that injures you in your skin, not in your in your body. Yes, so a headache is a symptom. It affects inside of yourself. And you feel your head kind of like it's having some things that really was hard. And you kind of like, don't feel good. You can't think well, and if you try to think hard of something, it would really does make your head to feel more bad, to feel worse. Yeah. So headache is a pretty important things. So next we have is a toothache. A toothache was just kind of like something that affects your teeth. When you touch or when you talk like this, you probably have your lips, have your tongue here, right? Touching to your tooth. And sometimes when there's a touching or a crashing near your mouth, you will probably have a toothache. It is a kind of thing that makes our tooth to feel bad. It doesn't mean that we're going to be taking that tooth out, but it means that our tooth was kind of like having some problems, and we need to check by the dentist. Yes. Next is earache. Earache is a kind of problems that happens to your ears. Usually, when you have an earache, your eardrums inside would probably hurt a lot. Yeah, if you have some really hard touch to your eardrum, it would probably be a little bit destroyed. I don't mean it has been destroyed, but no, it's still being used. But earache was something that makes your ear to feel bad. Yeah. Next, we have is a stomachache. Stomachache is a kind of problems that happen to your stomach. Kind of like if you're having your stomach not eating good, or if there's some thing inside your stomach that was not good, or if you don't eat your meal properly. If you don't eat properly, it probably have a stomach. And the way that you want to prevent from these is to eat in a daily way. Eat in a good way and don't, kind of like eat different things before you don't try to eat the main meals. Always remember to have enough good meals, especially breakfast. And if there's some problems that you think it affects by some kinds of worms or some kind of that is your body, tell your parents to buy you a special kind of medicine to help you to take out of that. Next is backache. It is usually happens when you work hard and you just always make your back to be curved down like this. You probably have a backache, especially you do that for a long time. I want to talk here that, okay, if we just do something like this, we wouldn't probably have a baggage. But usually, adults, when they curve their back up like this for a pretty long time, like 2 to hours minutes, it probably have a ache. Next is cold. Cold is when you go out, like it's a really rainy day, but you don't wear any raincoats. It'll probably have a cold. Or after that day, you go out and take a shower in the rain, you'll probably have a cold. I just told so. So the way to prevent the cold is to stop going out when there's a rainy day, and always remember to wear a raincoat when you're on the way. Next is fever, sore throat, sneeze, cough, nasal congestion. Nasal congestion was, for me, it wasn't really rare for me to have a nasal congestion. Nasal congestion was just kind of like there's something inside the way that you're in our nose like this. Usually there's just one part of your nose. How like it just happens in the right or in the left. It doesn't happen in two parts, in both the parts, but just one. It would have something that stick here. I don't know what is that, and that would prevent us from breathing in this part. So the way to get out of it is to use more, is to having a nice deep breathe. Breathe equally. And use special kinds of sprays. Like Symptons. Yeah, that'll probably help you to get out of the nasal congestion. So always tell your parents to prepare a nasal congestion spray in your house. It will probably help you to prevent that. Do that daily and it will help you a lot. Trust. Okay, next we have is Gnosis. Gnosis is when you have a feeling of like after you eat something and then that kind of feeling is coming up to your throat. Yeah, that was just kind of like something that's feel pretty bad for me. When I'm feeling kind of like I have a Gnosis, I will probably know that I'm going to have a vomit. What is a vomit? A vomit and a Gnosis, do they have anything that comes together? A Gnosis was feeling before you get a vomit. Yeah, vomit was kind of like you're going to push off those food that you have eaten before. Yes, that's vomit. You probably have that when you are on a car. If you have car sick or seasick, you're dizzy, you probably feel something that is kind of like Gnosis, or you probably vomit too. Next is dizzy. It's when you have a feeling. Did you guys ever try to do this? Let's try to do this with me. Stand up. Stand up, guys. Okay? I'm standing up like this, and now I'm turning my body for 360 degrees for a lot of time. Let's see. 5 to 10 times. Let's see. 7 times, okay? Let's see if we really get a dizzy. You don't need to do it fast, but don't do it slow, okay? 1, 2, 3, 4, 5, 6, 7. Now, sit down. Are you feeling dizzy? If you don't, then probably you are a person that doesn't get too much sick, doesn't get too much dizzy when you're going on transportations. So, yeah, that's good. Nothing bad. For me, it's a little bit dizzy, but not really dizzy. Yeah. Next is chill. Chill is kind of like feeling that you feel cold in your body, cold around your body. Have that now if you're staying in a really cold place and you're not faced with that, you don't face with that for unusual, you probably have too. Like a rash, burst, insect bite, cut, sunburn, body nose, and sprained ankle. So you see, there's a lot of symptoms and injuries in your daily life, and all you need to do is to take care of your health more, do more proper things, do more exercise. It will help you a lot, and also remember, always take care of yourself. And if you see there's any bad symptoms or injuries that happens to you, you should probably say to your parents. They probably know the way how to help you. And if there's no people around you, there's no mother, father around you, tell some kind of your friends or the neighborhood around, they would help you. And don't just stay in one place if you're having something, especially when you're nauseous or you are having a cut or sprained ankle. You should talk to somebody to get something. And especially when you have a sprained ankle, a cut, or something like that, always talk to your parents. Because if you don't tell them fast, if you don't talk to them, then it will probably make your legs to be broken. Yeah, so be careful about that. And always remember safety first. If you're having any problems, always remember to tell your parents or any people around that you know to get help. See you.